This video is going to cover section 11.2, which looks at the mechanism of breathing. So a free flow of air is vitally important during ventilation or breathing, and a spirometer is a device that's used to record the volume of air inhaled and exhaled with each breath. Here you can see a graph of the volumes of air which move in and out of the lungs during certain situations. And under normal circumstances, at rest, then we have what's referred to as the tidal volume. So this is the amount of air that, the volume of air that moves in and out of the lungs under resting situations. We have our maximum expiration, which everybody has, and then we have our expiratory reserve volume as well, which goes beyond the tidal volume. Notice also that there is a residual volume that you cannot ever actually remove all of the air from your lungs. It's physically impossible to do that. There is always a residual volume there which you cannot actually forcibly remove from the lungs. So the total lung capacity includes the vital capacity and the residual volume. So we'll look at these each individually. The tidal volume there, that's the amount of air that's inhaled and exhaled at rest. And for the most part, it'll be, about a half a liter or so, 500 milliliters for most people. The inspiratory reserve volume, this is the additional volume of air that can be inhaled beyond the tidal volume. So for example, during deep breathing. And then the expiratory reserve volume, that's the additional volume of air that can be exhaled beyond the tidal volume. So the vital capacity then, that is the maximum volume of air that can be moved in and out during a single breath. So the vital capacity then is the tidal volume plus the inspiratory reserve plus the expiratory reserve. The residual volume then, as we mentioned, this amount of air that remains in the lungs and the airways after a full exhalation. And so during normal breathing, only about 70% of tidal volume reaches the alveoli, and about 30% remains in the airways. So this air is not useful for gas exchange because it's actually been depleted of oxygen. The respiratory volumes, it depends on various factors. First of all, age. So the amount decreases after about the age of 30. Gender as well. So sorry ladies, on average, you have about 10 to 20% lower volume than men. Physical activity, so those who are conditioned athletes, they will have 20 to 30% higher respiratory volume than the non-conditioned athletes, shall we say. In other words, the armchair athletes. So with respiratory disorders, some disorders they actually decrease vital capacity, or they can increase residual volumes because the individual has difficulty emptying the lungs. And so this would be a situation with emphysema actually. So a person with emphysema, they actually have to forcibly exhale air from the lungs, which under normal circumstances you shouldn't have to do. So with inspiration and expiration, to understand this, the following facts should be remembered. There's a continuous column of air from the pharynx to the alveoli in the lungs. The lungs lie within a sealed off thoracic cavity. The rib cage comprises the top and the sides of the thoracic cavity. There are intercostal muscles, which are between the ribs. And then we have a diaphragm and connective tissue which forms the floor of the thoracic cavity. So the lungs adhere to the thoracic wall through the pleura, and the space between the two pleura is minimal due to surface tension of the fluid between them. With inspiration, inspiration is the active phase of ventilation. The diaphragm contracts and lowers. So when the diaphragm contracts, it actually lowers, which thereby increases the thoracic cavity. The intercostal muscles, they contract, and the rib cage moves up and out. So if you think of the ribs as being having sort of a C shape, which has makes a joint with the spine in the back and the sternum in the front, and in the resting position, the ribs they would be oriented in a slightly down position. So with inspiration, the ribs pivot and the spine and in the sternum, and they move in an up direction, and in doing so, it will actually increase the volume of the thoracic cavity. So as the thoracic volume increases, the lung volume increases, and air pressure in the alveoli decreases. So alveoli pressure is lower than atmospheric pressure outside the lungs, which then causes air to flow into the airways. With expiration, this is the passive phase, and this it simply takes relaxation actually in order for expiration to take place. So what happens is the diaphragm relaxes and it moves back up again. The intercostal muscles relax, which causes the ribs then to move down once again. So the entire rib cage then moves down and in. This then decreases the volume in the thoracic cavity. So the lung volume decreases and air pressure in the alveoli increases. Alveoli pressure is now higher than atmospheric pressure outside the lungs, and this causes air to be pushed out. And you can see in these diagrams here the physical things that actually take place. So on the left is inspiration. You can see the diaphragm in the down position, and the ribs have moved into more of an up and out position. And then with expiration on the right, you can see the diaphragm moves back up again, and the ribs move into a down and in position again. So the control of breathing, ventilation is controlled by the respiratory center in the medulla oblongata of the brain, and it stimulates inspiration by automatically sending impulses to the diaphragm through the phrenic nerve and to the intercostal muscles through the intercostal nerve. So although we can consciously change the rate at which we breathe, under normal circumstances, we actually don't really have to think about it. It does occur automatically through this process. When the respiratory center stops sending signals to the diaphragm and the rib cage, the diaphragm relaxes and expiration occurs just passively. So following inhalation, stretch receptors in the alveolar walls, they send inhibitory nerve impulses via the vagus nerve then to the respiratory center, which inhibits the respiratory center from sending impulses, and therefore expiration takes place. Control of breathing is also through chemical input. We often mistakenly think that it's the oxygen levels in the blood that causes this, but actually that's not the case. And it so happens that it's actually the levels of carbon dioxide and hydrogen ions in the blood. So when these rise, then the respiratory center, it increases the rate and the depth of breathing. Respiration rate is also influenced by cells, called the carotid bodies and aortic bodies. So when concentration of blood oxygen decreases, these bodies, they signal the respiratory center to increase rate and the depth of breathing. Um, there is a modulation by the blood oxygen levels, but more so from the carbon dioxide actually. So that then summarizes the process of inhalation and exhalation.